Hi, my name's Dan Lasserson. I'm the medical lead for the acute hospital at home service at the John Radcliffe Hospital in Oxford, and I'm also a professor of acute ambulatory care in the medical school at the University of Warwick. I lead a team of nurses and pharmacists and healthcare assistants who deliver acute hospital at home to people who live in Oxfordshire, and we deliver a service that tries to replace, as far as possible, the acute medical admission. While our focus is on the older adult who lives with frailty, we will see any patient thought to be treated out of hospital with an acute medical illness. And for us to be able to do that, point of care ultrasound is absolutely essential in how we diagnose and monitor patients that we treat. My research is based on trying to find the optimal model for acute medical care that's sustainable for the future. We've seen the acute medical care pathway, both in and out of hospital, get busier and busier and busier over the years. And the research that I do is trying to work out how can we treat more and more patients well in a way in which they like to be treated with their acute medical illness, in a way that reduces the burden on the acute hospital and allows us to adapt our acute care system as our older population grows in number, and hopefully we can treat them in a way that reduces the need to come to hospital or can keep their time they spend in hospital to a minimum. Point of care ultrasound has been the most incredible intervention in diagnostics that I've learned to use since I qualified as a doctor over 20 years ago. The ability to confidently make diagnoses at the bedside using ultrasound imaging has really changed the way that I practice, and I've managed to use it in the home and the care home as part of our overall diagnostic strategy in the acute hospital at home. When you're treating patients outside hospital, you need to have a really good idea what's wrong with them so that you can get the right treatment started as soon as possible. It's how we mitigate risk in acute hospital at home, is making sure that our diagnostics are as good as possible. And with point of care ultrasound, we've been able to do screening echoes, lung ultrasounds, looking at the abdomen, and all of the other amazing applications of point of care ultrasound that you'll be able to read about in Ultrasound for the Generalist. And we've been able to use it as part of our standard assessment for patients in hospital at home. And this means that we can deliver what we think is probably at the cutting edge of acute hospital at home care in the UK and beyond. So POCUS has a critical place in our hospital at home management programme. As part of our initial assessments of patients, we'll often be using POCUS in order to often rule out conditions we're concerned about, but also to make positive diagnoses around conditions that are there. As well as diagnosis, it obviously helps me critically when I'm trying to assess a patient's fluid status, and that in turn will help me guide fluid prescribing as well as altering any other medications that patients are taking. The other element in which we use it is for training. So while there may only be one or two POCUS practitioners in a broad and multidisciplinary team, it's a skill that should be core for many of the members of the MDT in acute care. And we're training up our nurses and our clinical pharmacists who come with us on visits in the use of point of care ultrasound, so that when they are attending patients alone, they'll be able to use POCUS as well as the other assessment methods that they use, and then they're able to share those images with more experienced members of the team who may not be present physically but can still support remote decision making using POCUS images as an adjunct to all the other information that we're getting to optimize remote decisions or remote decision support for the nurses that may be seeing patients if they're out there by themselves. So we see POCUS as a really core way for the team to work together in a disparate way. We may not always be together at the same time in the patient, but we'll always be trying to work out how we can pool our expertise and resources to make the optimal decision as soon as possible for patients in their own home or care home. And also for us, POCUS is important in our governance and our training modules as well. So certainly the platforms that allow us to share images and looking at images that were recorded earlier help us train and develop and make sure that all of us who use it can get better and better and better. So this new book, Ultrasound for the Generalist, is going to be a huge help for all of us out there, whether we work in hospital, in ambulatory medicine, or in the home and care home, who are in the acute care pathway. The book will allow us all to extend our skills in a guided and supported way as we develop our own ultrasound proficiencies in all body systems. And critically for me, it'll help me as I train the next generation of users of POCUS in acute hospital at home. It's a fantastic training resource, and with the right guidance and mentorship, then the people that will be using it as an adjunct to their practice on the ground will really fly in how they develop their skills and provide even more valuable support diagnostically to patients in their own home and care home as part of an acute multidisciplinary team. From the research side, this will be really helpful to me and to those that I work with in clinical academia as we test the ways in which point of care ultrasound can be used to further our management of many conditions, whether that's heart failure or pneumonia, or whether we're making judgments based on fluid status in patients and finding ever more refined ways to get more accurate decisions for clinical management based on ultrasound parameters. So this book is going to really help us as we embed point of care ultrasound into our clinical practice and establish a new field of how we can research optimal decision making and optimal care model design using POCUS as a core diagnostic element. Ultrasound for the generalist, I think, has a huge appeal across all those who care for patients, whether in the acute setting like where I work, but also in primary care, where you may be seeing patients who have long-term conditions, where there may be exacerbations from time to time, such as in heart failure, and also in more rural and remote settings where the option to transfer to hospital for more formal cross-sectional imaging just isn't there. And anyone who sees patients with undifferentiated illness should develop skills in point of care ultrasound to make rapid, reliable diagnoses at the earliest point in a patient's acute care journey. And so I see that Ultrasound for the Generalist is a book that's, yes, it's for doctors like me. I need to make sure that my skills get better and better and better as I use POCUS more and more. The nurses that I work with, it's essential, I think, for them. And our clinical pharmacists, our clinical physiotherapists as well, should also develop skills in this book. And this could be for clinicians who work in a range of settings as well. So yes, it's for the generalist, but it's also for members of the multidisciplinary teams that work with generalists in their care of patients. I think certainly geriatricians and training geriatricians should find this a really valuable skill as part of their assessment for the complex older adult. And we know it's already going to be embedded in the acute internal medicine curriculum. But I think the appeal and use of POCUS goes way beyond those medical specialties. When I was a medical student, I wish I had learned POCUS. I wish that the ability to do POCUS had been there, because I would have leapt at it straight away. And I think many of those who use POCUS every day now also think the same. The junior doctors that see us using POCUS on our daily rounds, as well as medical students, current medical students, are also fascinated by what this technology can add to their decision making, and also as they're learning about pathophysiology in the acutely ill patient. So I can only say that POCUS, I think, should be an essential part of the undergraduate curriculum. I think that all undergraduates in medicine should learn point of care ultrasound, and read ultrasound for the generalist. I think it will help them as they understand how the body is affected by disease. It'll help them learn functional anatomy. It'll certainly help them understand the heart in a much better way, I think, than I did when I was learning cardiology as a medical student. And once they had mentorship and training throughout their undergraduate careers in point-of-care ultrasound, when they qualify as doctors, they will be so much more confident at decision-making, certainly in the acutely deteriorating patient, whether they work in the emergency department, supporting different specialties on the wards or in acute medicine on take. They'll be able to make very confident decisions. They'll be able to share their images with radiology colleagues and seniors as they optimize any further imaging that may be needed, or actually, we have enough diagnostics, so we know what's going on, let's get on and treat. Now we have our ultrasound images to view. And it'll also mean that they'll learn skills they can take with them wherever they end up practicing medicine, whether in community settings or acute settings or hospital at home, even where I work. And also if they do work in more rural and remote healthcare environments, this is a core skill that will be with them as they develop as clinicians over the years, and as they develop additional indications and further refined uses of point-of-care ultrasound in clinical medicine. I think will need to come from a much greater and broader group who are able to use it, and that I think will come from making sure that POCUS is front and centre of medical school curricula going forwards.